Welcome, everybody, and thank you for joining our coffee conversation on fixing the price tag on health and telling stories that stick. My name is Steve Hamill, and I'm the VP of Policy Advocacy and Communication at Vital Strategies. Today, I'm powered by a $2 coffee from our corner deli. One milk, one sugar is my preferred order. Before we start, I want to do a little bit of housekeeping. Just to remind you, this isn't a formal webinar. We wanted to make this an open Zoom conversation and include audience thoughts, comments, and questions, but we had more than 200 people RSVP, and we didn't want to fight people getting on and off mute. I'm sure we've all had that experience. So instead, I'm going to be monitoring the Q&A box and monitoring the chat to try and get your comments into this conversation. We're also going to be trying some polls. We're going to launch our first poll now towards a more freewheeling conversation and conversational approach to get these topics and these thoughts from our experts and our panelists and from you. So we're here to talk today about non-communicable diseases. That's like heart disease, cancer, diabetes, and we know that these are now the world's top killers, responsible for more than 41 million deaths each year. But the twist is that these aren't just about personal choices, as some people would like us to think. They're about systems. Junk food and sugary beverages are cheap, and healthcare is costly because of it. And that's what we mean for this session when we say fixing the price tag of health. We also want to talk a little bit today about health taxes, small fees on products like soda, alcohol, or tobacco that we know can cut consumption of these harmful products and raise money for governments for health programs. And lastly, our impetus for this kind of informal conversation is we know that increasingly the public gets their news from social media platforms like TikTok and Instagram or Blue Sky. And to promote the health policies that we care about, we know it's not enough for public health folks to get experts to go on TV or radio or to release data. We really need to go where people's eyes and ears are at. And that means working with content creators. It means that public health people have to use their own voices and platforms. And we have to get used to talking about our issues in ways that the public can really relate to. I've heard Marianne say many times, we have to put the public back in public health. And that's part of what we want to go over on this session. So I hope you hear some stats today. We'll be talking a little bit about statistics, but we're also trying to mix in some stories. How do we tell stories? And how can we make these issues relatable for everyday people, especially through social media? So I'm going to introduce our panelists now. We can dive in. Dr. Marianne Etiebet is the president and CEO of Vital Strategies. Marianne, what's your go-to coffee drink or?
Black Americano, no sugar, iced, even in countries that don't understand iced coffee.
I love it. Yeah, that's a challenge sometimes, right? Next up is Dr. Adam Karpati, SVP of Public Health Programs at Vital. Adam, what are you drinking today?
Hi, everyone. Drip coffee with hot milk.
All right.
What kind of milk?
2%.
Okay, you have to ask. There's like 7 different types.
Fair enough.
I know these days it's like oat, soy. We're also really happy to be joined by 2 folks who were born into the digitally native generation, and I think that's a critical component of this conversation. Pierre Cooke Jr., who also goes by Kevin from Healthy Caribbean Coalition, and a youth activist. What's your drink of choice today, Kevin?
So I roast my own coffee. Well, I brew my own coffee at home using a French press, but it is a local roaster, Wyndham's Barbados, and it's really, really good. Really good stuff. No milk.
Yeah. I've climbed up Blue Mountain, and I always look for Blue Mountain coffee.
It's really good.
Yeah.
You've got it. Last but not least is Margarita Otero, a food policy fellow and PhD candidate. Margarita, what drink did you bring into our conversation today?
Hi, everyone. First off, thank you for the coffee recommendations because I want to try that one now. Today I'm drinking matcha, cardamom matcha, because cardamom elevates everything. So
Yeah, as does, I mean, matcha's like the new hot go-to drink.
yeah.
All right, so let's kick it off. Marianne, I'd love to start with you. As I started the top with, NCDs are now the world's leading killers. Can you share what are the data points you think are most important? And just as importantly, what's the way of explaining this that you think is the most engaging? How do we get people to zero in on this as a critical issue?
Yeah. And I'll start with, who knows what NCDs means? Because I've asked my sisters, I've asked my kids, they don't know what NCDs mean. And so I'd actually be interested to understand how many folks, on the call know that. And that's exactly why we want to have this conversation with you, because we want to make sure that what we're talking about, and what we care about and what we think you also care about is resonating. And we are communicating in the right ways. We are using language, again, as I said, that resonates, that you are using, in your conversations. And I'm not sure we are, I'm not sure that we are reaching everybody we need to reach. And part of that maybe because, we are quote unquote, not speaking the same language. And so you may know or you may not know that I joined Vital Strategies about a year ago. And part of the reason I joined it, I'm from Nigeria originally. I hit 50 last year. I'm actually one of the kind of younger age group in my generation of cousins. And, I've had too many family, extended family, friends of extended family, literally, dropping dead on their way to church from what's likely a catastrophic stroke, from untreated hypertension. And these stories come up, in WhatsApp group messages again and again and again and again. And as somebody who's working in global health and really wants to make sure that everybody everywhere, irrespective of where they grew up or where they were born or where they live now, has access to the care that they need and the information that they need to take care of themselves and to live the life that they want to live. That's not happening. So that's why I'm in this work. And the fact that things like diabetes, like hypertension, like cancer, like heart disease, that's what's killing us. 75% of folks around the world, were dying from these chronic diseases. And as a global health community, and in many countries, there's just not enough attention being paid to these diseases. And we know that they're preventable. We know that they can be caught early. We know that they can be treated and managed appropriately. And we know that they don't have to kill people before it's their time to leave. And so, that's why I'm doing this work. And that's why I think it's so important we get this message out to as many people as we can, because there's something that we can do about it.
Mm-hmm. You know what? There's amazing. I'm going to just pull in some of the things we're hearing in the chat. Thank you for that, Marianne. I think people agree with you. Like somebody said that they had a life-threatening NCD, and that's given their life purpose. And I think this notion that people have personal experiences, they know people with cancer, they know people with diabetes, is sort of the lane to give people to understand the sort of the bigger social issues. The word lifestyle diseases came up in the chat. We have somebody saying they never heard of NCDs before they came to work in a public health organization, but they knew what cancer and diabetes was. I think that gives us one kind of clue. A lot of people are talking about how these are like long-term and costly diseases. So some great comments we can capture in the chat. Kevin, I'd love to just pivot to you for a second. You do a lot of youth advocacy. Sometimes NCDs like cancer and diabetes are thought of, they're not the diseases of youth. Like, how do you get young people to think about like what's the entry point for explaining this in a way that gets young people fired up to care about these policy solutions that we care about?
Yeah, I think first of all, what we saw in the Caribbean is that by and large, young people think that NCDs or conversations around NCDs, it's not sexy, it's not fun. You're talking about health, you're talking about diseases, and it's not really interesting to us. But what we found is that when we went into schools and we spoke to young persons and we said, hey, you know, the daily recommended sugar intake is this amount, and then that drink that you have in the morning before you enter into school, it has like double or triple that amount of sugar. And then we show them the through line of the consumption of or overconsumption of sugar sweetened beverages, certain foods that are marketed towards them. And we show them the through line to how that affects their health in the future. So for the most part, persons could say, well, I have an uncle, an aunt, a mother, a father, a grandfather who has diabetes, who has high blood pressure, who's going to die from it. And they think that that's the natural course of their life. But then we pointed out to them, that's not necessarily true. It's preventable. So even in the chat just now, we saw a lot of persons speak about lifestyle diseases and that, you know, it's a matter of how you live your life and sometimes hereditary. But what we did was point out to them that through predatory marketing, through direct advertising, through targeted efforts, big food corporations are making you sick and it's preventable. And then they kind of sat up and they were interested and they were like, tell me more. How can we stop being pawns in a game of profit? How can we have more agency in this conversation about public health and making sure we have a healthier future? And it did lead to great traction. We now have groups of youth advocates across the Caribbean who have just come forward and said, hey, I would like to be a part of this. And so we're building a strong movement.
That's awesome. Marguerite, I saw you nodding your head. I know food is an area of interest for you. What did that bring up for you?
Yeah, I mean, I think when talking about chronic diseases, right? We just got through COVID, and I think a good like comparison is like we saw how a tiny little bug made a lot of us really sick, right? And when we think of chronic diseases, it might seem less visible, right? Because we so many people out there are dealing with these conditions and their lifestyle conditions, and we might not think of it as related to COVID, but just in the way that you know, a tiny little bug made a lot of us really sick with COVID. We have food, tobacco, alcohol, all of these factors that are making us really sick, just like the virus made a lot of us really sick. And I think understanding it that way so that we can approach these factors that are making us sick, these industry practices that are so broad encompassing and that affect all of us, I think that's a good way to reframe it. I found that I think just because we all have that shared experience of what that was like.
I love that. And, you know, that's really resonating in the chat. Thank you, everybody who's contributing. People are talking about storytelling, personal storytelling, and the power of zooming in on one person's experience and then relating that to something larger. Another person said, like, how do we reinvent our language? NCD is really opaque, right? Like nobody knows what that means.
Yeah.
You know, like nobody uses outside of this, people like these, you know, these public health conversation worlds, you know, to describe this and including describing the solutions. Adam, maybe I can pivot to you for a second because we want to bring like the health taxes frame in, like what one of the most important solutions we're talking about is health taxes. Can you explain them really simply, bring that into the room? And then are there real world successes we can look at that we can point to? Because I think that's something that that we're seeing in the chat is like, how real can we make this? What are the real stories, real examples that we can point at?
Thanks. And yeah, speaking of opaque language, just wait till what I'm about to say. It'd be great to get some input on that too. So as my colleagues have said, the thing about non-communicable diseases is that a substantial portion of these heart disease, cancer, diabetes are preventable. And we think about public health, you know, a lot of people think about it as, you know, doctors and nurses and hospitals and clinics, but public health is also about prevention. And that piece, the preventability, leads us to some really important lessons and opportunities. So we've talked about the drivers of NCDs, the causes, and we know what they are. Tobacco use, unhealthy diets, alcohol consumption. Physical inactivity, also really important. Air pollution, also very important, also preventable. But let's talk about those commercial determinants of health, talk about an opaque term. Alcohol, tobacco, food. The World Health Organization has compiled all the global evidence, the science behind how to prevent NCDs, how to deal with these three products. And there's many proven strategies for how to reduce consumption and improve health. The most important intervention, the most important strategy is to raise prices. And the way to raise prices on unhealthy products is through taxation. And so when we say health taxes, we're talking about governments imposing taxes targeted to unhealthy products. These are so-called excise taxes that will in turn raise the price, reduce consumption, and by reducing consumption, improve health. That's the mechanism. We're talking about impacts across the population. These are not only strategies to address the highest consumers, the most extreme levels of consumption. We're talking about reducing consumption across the population. And these strategies, in addition to being good for public health, they're good for governments because they raise revenues. The improvements in public health reduce healthcare costs. So we like to talk about this triple win: improved health, improved government revenues that they could use for good things, and reduce healthcare costs. And just to say, there's great examples from around the world of countries, governments committed to public health doing this. Just in a few regions of the world. In Africa, we look at countries like South Africa around tobacco, sugar-sweetened beverage taxes, where we've seen important reductions in consumption after the South African government imposed those taxes. Government in Botswana did some great work on alcohol taxes. Mauritius, Cabo Verde, Ethiopia, other great examples. In Asia, I'd point to the Philippines and Thailand. Philippines, the so-called sin taxes. This was a concerted effort across all three products, has been highly successful. Thailand, a good example of using tax revenues to pour back into the public health system to support treatment and prevention. And in Latin America, I would point to there's a big tax reform happening in Brazil now, and there's some great opportunities that the Brazilian government is really being, really world leaders in this, and we have big hopes that work is going to pay off. And in Mexico, the government has just introduced new taxes on tobacco and sugar-sweetened beverages. We wish they would do so on alcohol as well, but just those two products is going to make a big difference as well.
Marianne, I saw your hand go up.
Yeah,
and
I didn't know if I was
furiously.
being too formal, but anyway.
You jumped in.
Yeah, I wanted to kind of connect the dots between something Kevin said and Adam's point around, prevention, and someone in the chat talked about lifestyle diseases. The other thing that really annoys me is I think for too long, the kind of thing out there in the world is that it's your fault, that you have an NCD, because you're smoking, you have cancer. It's because you're not exercising, you're overweight. Because you don't eat well, you have diabetes, and that's just wrong, because we know, as Adam was saying, that there are things that can happen in society that make it easier for you to do the right thing, and don't put the burden on you to fight against, all of these structural challenges, to stay healthy and be healthy. Kevin talked about for going to school. If that's the only thing that are in vending machines, or those are the only things that are being sold outside school gates, then how are you supposed to have a healthy option, that you can afford? And so part of the reason I was so excited to join Vital Strategies is we're really trying to get at this from the root cause. And we're really trying to push solutions that make it easier for everybody, to make the choices they want to make about their health, and make those choices easier. And so, really trying to flip the script on it shouldn't be an individual burden. It shouldn't be thought of as a lifestyle choice. This is really something we can all band together around and make sure that, whether it's governments or whether it's, companies and corporates and industry, that we are putting the pressure on for them to take responsibility around creating environments that we can all live our healthiest lives.
I love that. And I love that the ambition to, it's like, what are we for, right? We're for environments that empower us to live our healthiest, best lives. And I think it's shocking. People are shocked to find out that, big food companies, they will pay money to put unhealthy commodities like the sugary stuff, like in the middle of an aisle so that it's at eye level or at the front of a store. Like, I think people, I can't remember, somebody said it's like, these aren't just things that are happening. These are, choices that, or like options that are imposed on us in some way by people who have a profit motive, and they have the ability to shape the environment that pushes millions of people into making unhealthier choices, even though that's not they want, that's in the wrong through. And I think people are shocked. I think you were saying that, Kevin, too. They're shocked to find out that there's an agent on the other side that's constructing the environment that makes the least unhealthy choices the most obvious ones. I want to bring something a little bit different into the room, which is about like social media storytelling. What we're going to ask a poll around, like, what in the audience, what channels you think are the most important. Please take it. But maybe, like when you look online at how like really successful content creators tell their story, they often start with this, what we talked about is this personal frame. Like, what do people see in the supermarket? What are they experiencing through their friends and family? I love the notion of like demonstrating how much sugar is in a Coke. But are there other ways that you've seen successful storytelling show up online? Like, what do we have to do to bridge the gap between this sort of like intuitive, personal view and what we want, which is like the systems level, demand for systems level changes that approach people? Margarita, I thought I might start with you because I know Mexico just announced this like tremendous sugar tax. I know you care a lot about sugary beverages. How is that showing up in like the Twitter sphere and the TikTok sphere? Is it showing up there? What do those look? What is it, mostly misinformation? Are people advocating? What does that look like?
Yeah, I think I mean, first of all, it's very exciting, progress, and we need to, this is why we need to continue to do this work, is to push the needle forward on these policies. I've seen a little bit of everything, but definitely like you see a lot of the conversation sway towards like making this an individual issue, right? Of conflating these policies with like less choices. And something that, I like to bring us back to is so much of the food environment is built by, it's built by the world around us and the factors that shape our diets. And it's all about like what's available, what's affordable, what gets advertised to us. And when we think of these policies, I mean, I was just looking at my local grocery website this morning, just to see where we're at on things. And I was curious to look at what deals are going on. A coupon pops up, and I literally had to take a screenshot of it because it was $1 of milk if you buy the family size Oreos, right? Like milk, a staple product for so many families. And the nudge is to go towards, the unhealthy products. And all of these things shape our diets. And the fact that we are framing these issues as individual issues misses the point that this affects all of us. And that, there are systemic factors, as we were talking about, that are very much, concerted efforts to prioritize profit over health. And I think that's where we need to switch the script online. Is I'm seeing with this, in the era of social media, we can share information so quickly, we can spread the word so wide, that I think there is this like hunger for transparency and accountability. And that's where we come in, right? That's where we need to hold these big, powerful corporate actors accountable for the health impacts that they have. And we need to stay away from the individualized notion of these policies and the frame that I'm currently seeing.
Adam, jump in.
I just wanted to point out, just build on that, like the strategies for what that upstream context changing approach looks like is actually quite common across these different products, right? We're talking about health taxes, right? So that's about price, and that's obviously something that could be applied across all the products. We're talking about marketing. And the way in which industries market these products. So regulating the marketing of unhealthy products, again, common across the products. And the third big bucket is availability, right? So that's all about regulating the availability, whether by age or by hours or by who can buy and where you can buy. That's another thing that's very common across the three. And then the fourth, labeling, consumer information. So the point I wanted to make is that the basic strategies, the public health prevention strategies, are quite applicable across all these different so-called risk factor products.
I love that. And what we're pushing for, I think it's like labels are consumer empowerment. Like people want labels. They want to know what's in their food. They want to know what's in their drink. And that's very popular. And one reason why big industry pushes up against it, I think.
Yeah. No, information is power, and I think, Kevin, you said something, and Margarita, you said something around free will. I had to make peace with, like, we are not living in a world of free will anymore. Some of you may not have been around when Facebook started. It took me 7 years to get on Facebook because I was like, there goes my privacy.
Right.
So I've made my peace with there. Not only is there no privacy, but I'm being manipulated, on any social media platform. And, it took me a while to get there. But the same way, Adam, you talked about, there's kind of deliberate thinking behind, what information is shared, where these products are placed. And I think that's even more so on social media. And, I saw some of the responses in the chat to what kind of platforms people are using and think are more effective. I'd love to hear folks' thoughts about, how are people thinking about agency and free will, and, what gets people upset, around this, or, is that just the way the world is right now? And, we just, have to, as I like to say, it's not my world, I just live in it. I'd love to hear folks' thoughts on that. And Steve, if I can ask, I would love to have one of our chat questions be, what word should we use instead of NCDs? I'd love to hear from folks on the line, what word we should be using, to talk about these health issues that, we care a lot about, and we know you care a lot about too. But somehow, our lines of communication are not crossing.
There's just like the chat is on fire, and I'm loving what people are contributing. So the current question is, what what should we say instead of NCDs? How do we get people into this? There's some great comments here about, I mean, first of all, we saw from our poll, 75% of you think that short videos are like the most important way that we can get information out there. And there's some, parallel thinking on there that I want to share out that I think is so important, which includes people talking about this notion of agency. I think embedded in a lot of these points is, unfortunately, we live in a world of social media algorithms presenting this information, and that means it's up to us to make this information interesting. Only interesting things live on social media, and the key to making things interesting is also making them emotive. Like you use the word upset, Marianne. Like what makes people upset? What makes them laugh? What makes them angry? What makes them curious? And as public health people, I think we're often trained to present the data and then leave it there. The data is going to generate its own momentum. And in the current day, that is just not enough. We have to engage people's curiosity, engage their sense of agency, engage their values, the sense of unfairness that they're being targeted by these big industries. I know, Kevin, back to this notion of short videos, and I know your organization's worked with creators, you've generated some of your own, what have you seen works on short videos that engages people's interest and curiosity and anger and laughter? Are there tips you'd love to pass on?
Yeah, for sure. So I think it's about making the information as simple as possible to communicate to your audience. And the two things we look at is the message that we're communicating and the person who's communicating the message. Necessarily, when we're speaking to young people, we try to have a young person communicate that message. And the way that message is crafted is not that we're speaking at you, we're not blaming you, we're not pointing and wagging our fingers and saying you should have done this, but we're having a conversation with you. So I see on TikTok, there's a model of starting by using a hook, a shocking statistic, or using some demonstration. And in the same way we spoke about the sugar, one of the examples we would use in the school is actually to take teaspoons of sugar and show persons how much is in an actual bottle of soda. And if you're drinking 3 to 4 of these bottles of soda a day, how much sugar you're consuming. Another way of thinking when crafting the message as well is to let people know that what is happening in their food environment is not by coincidence, it's strategic. And so a lot of persons think that the fact that this cereal is eye level is just a coincidence. They didn't really think about it. They just placed it there. When we talk about the marketing at schools, we talk about marketing and certain companies funding sports programs, they think it's just by coincidence. They like young persons. They want to support youth. They want to support youth activism and youth development. But then you point out that they're strategically targeting young persons at an early age so that they can build lifelong customers. When we explain to persons, hey, have you ever thought about why there's a children's meal at certain fast food corporations when this food isn't healthy? We know it's unhealthy, but why are we marketing it to children? People get upset when they realize they're being duped. Mm-hmm. And in this day and age where people want clear information and honest information, they get upset when they realize they're being duped. So I'd say craft your message in a way where people think. They go, I wonder why that's the case and what can my government do about it? And I think that's how you end. You end with a call to action. This doesn't have to be the case. It can be changed if this happens. And you give them something they can take away from your video and act on.
I love that. And we're seeing that somebody said in the chat, instead of saying NCDs, kind of talking about pivoting from your question there, Marianne, ask the question, what's causing you to get sick? What are the reasons behind it? Like you're saying, Kevin, it's not coincidence. These things don't just happen randomly. It's not because some finger wagging, something you did, you made a bad choice. There's a strategy here that's making millions of people make unhealthy choices, or making that the most obvious or the easiest thing to do instead of the easiest choices. Yeah, that's fantastic. Fantastic take. And just another say that there's also great endorsement here on focusing on the messenger, right? Especially in the social media era, and something public health. Let's be real. for a moment, is facing this kind of collapse of credibility. The world is facing this kind of collapse of credibility around expertise because everybody gets to be an expert now. So one of the things we have to do is recruit more messengers who already have audiences, who already know how to speak to people, who already are connecting the dots in ways that could be empowering to people to get information out there. Adam, go in, jump in.
I'd love to ask some questions and maybe just point us for a moment on the tax issue, right? Because as we said before, like taxes are probably the most effective way to address these issues along with those other strategies, but tax is really important. And yet around the world, though there are some really good examples, the vast majority of governments have not done this. And it seems such a straightforward, logical, issue, the way I was laying it out before, right? It's win, win, win. And yet it doesn't happen. Why doesn't it happen? Of course, we know why it doesn't happen because, people don't like taxes. And the industries that behind these products fight very, very hard and influence governments against them. So we know from polling, the polling that our organization, Vital Strategies, has done, as well as others, that in general, when you ask people about support for taxes on unhealthy products, the majority of respondents will support. That support will get even stronger if you say that there's a way to direct those tax revenues towards public health or education or social services. Support goes up even further. How can we speak more compellingly and get governments to really take this kind of action? And I also love that people talk about sort of this idea of sin taxes versus health taxes, because that's another issue we talk about.
All right, audience, you get into the chat. How do you think we can advance health taxes as a popular concept? Marianne, what do you think?
I never thought I would be somebody who would be talking about taxes. That wasn't in my, kind of professional life plan. But as Adam said, it seems like it should be such a slam dunk, and so being able to, first of all, understand why this is important. We feel that this is important, and figure out, is it important for you? Is it important for your audiences? I think we have to ask the question. We can't assume, no assumptions here. And then what is it about that makes it important, and how can we hook into that? And so part of the reason I've become, like a health tax, freak is that it's a natural solution that we have that we know works. It's been proven to work. We know it can be done. There are governments that have done it. And we know that it can help everybody, support everybody, reach everybody. So it's also something that has equitable impact, and folks can access the benefits, of this solution, whoever they are, wherever they are. And for so many of our solutions in health, access is an issue. The solution doesn't reach everybody we think that it needs to reach. And, we haven't brought this dimension, to the conversation, but the people these industries are making sicker are folks who are usually poorer, have, less education, working harder, or live in countries that are also poorer. And that should not be the case. And again, it's a deliberate strategy because there's less regulation and there's less people paying attention, to these communities. And so, people are able to get away with it. And so for me, it's really important that the solution we're talking about is something that can help right, that inequity, in the impact of these harmful products. And then the other reason is it doesn't cost anything. It is basically a biro signature, of somebody. It doesn't cost anything to do. And so that excuse is off the table, when you're, it doesn't cost anything to do, but it does remove profits, from different organizations. And so to me, it's righting a wrong. It's again, we talk about fixing the price, on health. Consumers, communities should not have to pay for poor health. The people who are putting poor health out in the world, they should be the ones that are paying for poor health. And the tax puts the price in the right place. It puts the price with the industries that are making these harmful products. So, again, that's kind of why we're beating the drum on this. But we know that there's a lot of pushback, and a lot of pushback is around the misinformation and disinformation that's out there, around these issues. And so being able to, kind of pierce through, all of the noise, and get the facts to folks is something that, we're trying to figure out how to do.
Fantastic. Margarita, final thought to you before I do some wrap up. I see you have your hand raised.
Yeah, no, absolutely. I think, Marian, you brought up so many good pointers to why this policy makes sense, right? Health taxes just make sense. What doesn't make sense is industry funding big sporting events like the Olympics for decades, right? But I think you also brought up the point of knowing your audience, and to content creators out there, you know your audience, whatever it is, whether it is, people passionate about nutrition, the environment, social justice. These issues affect all of these areas across the board. And whatever angle you want to take on it, like tap into your audience's passions and interests and fuel that fire. And I think that's a very effective way to get your message across.
I love that, right? Bring your own expertise and your own perspective and your own knowledge. And we could go on and on. I want to thank each of you panelists, and the folks in the audience. We're going to capture a lot of this. I have a final question for you in the audience, which is, if we do this again, how could we improve this session? What do you wish we could cover? Like, how can we help you talk and engage everyday public around this issue of NCDs? I just want to conclude with a few thoughts that I encapsulated here. So we know that NCDs are incredibly important, and health taxes are the most important issue. We didn't even talk about the high-level meeting that's happening next week at the United Nations. The world's leaders are gathering to talk about what should be prioritized. So we would love people to use their own voices to talk about this moment in health taxes. And I think we have a slide we can share about some of the hashtags you could use. So, and just to conclude with some of the thoughts I heard here, we heard about how important messengers are. We heard to start with a hook, something that's surprising or emotive that captures people's attention, and maybe even expose what's in people's everyday lives, right? Whether it's lack of access that they see, the diseases that are present in the families around them. Sugar in people's food came up a lot. Posts and messages that touch people's values and emotions, including, I love how you concluded, Marianne, with talking about who's targeted, the inequity that this drives, I think is so critical. And that there is a bad guy at play here, right? We have to expose the industry. This is a strategy for profit making that comes at the expense of the health of whole populations. And lastly, we didn't tease this out fully, but maybe don't start with the word NCDs. Start with what the terms people know: cancer, diabetes, lung disease, heart disease, and then bring people into the world of NCDs. I want to thank you all for joining us online, and panelists. Thank you so much for just a fantastic conversation, and onward to advocacy around NCDs, especially in the next week.
Yeah, and if you send anything out, tag me, and would love to see all the content coming out of this call, and thank you for helping us spread the word.